feel really lucky to get to have the job that I have, and there's a lot that's rewarding. One of the things that I find most rewarding is helping women decide how to have successful pregnancies when they're ready to have a successful pregnancy. We take care of a lot of really average risk women, and they're pretty straightforward and often come in knowing exactly what they need to do and have already done it. We also take care of some pretty high risk women, and I really enjoy the challenge of helping them prepare their body the best that they can for pregnancy, and then helping them navigate that pregnancy in a way that's healthy for them and their baby, keeping in mind that even if you have a high-risk pregnancy, we can still create an experience of pregnancy that's great for you. It doesn't have to be all medicalized, and we can help you have a birth often that is very natural and a wonderful experience, and helping women go from being fearful of pregnancy because they don't know what to expect, or they've been told they'll have a high-risk, very medicalized pregnancy, to getting to a point where they can feel like they're enjoying a normal pregnancy, and when the moments come that allow for that is really, really rewarding. So patients often ask me why I chose OB, and my gut response is, why would I not choose OB? This is awesome. What I get to do is truly amazing. And really, my interest in pregnancy and birth started as a little girl in the country. I loved when my cats would have kittens and my dogs would have puppies, and I thought I wanted to be a vet for a long time. And then as I got older and more mature in my recognizing what I actually liked, I realized I wanted to be an obstetrician and help women have healthy pregnancies and healthy babies. Then I realized I was going to need to go to medical school for that. So I started that journey. And then in medical school, I flirted with a few other specialties, but I always came back to loving taking care of women, and particularly pregnant women. I think when women think about having a baby, they spend a lot of time thinking about it, and a lot of time about who to invite into their community to help them with this process, specifically who they're going to choose as their physician. Most importantly, when you meet that physician, to feel like you understand where they're coming from and that they listen to you, and they understand where you're coming from, and that you find a common bridge in communication, and that you understand their practice style. Many practices are large group practices, and you may have a doctor that you see at all of your visits, but that may not be who comes to your delivery. It may be that they share call with a group outside of their group, so you want to understand the call structure. Our practice is a unique practice. We're a small practice. We're 3 female physicians and 2 nurse practitioners. The 3 physicians do all of the deliveries. We tend to attend almost all of our own deliveries. We do a call rotation, but we make sure that every patient meets every doctor. And there's only 3 of us, so it's not a lot of people to meet. And our patients tend to feel really comfortable with each of us because there are only 3 of us, and they always know who's going to be at their side when it's time to welcome their baby. And to me, I think that's a really important thing, is to make sure that you understand who's going to be taking care of you, not just at all of your visits, but when you arrive to the hospital, who's going to be at your side.